In patients with a large effusion in whom a thoracentesis is considered, assessment of the minimal interpleural distance will not be that relevant. This is because the risk of puncturing the lung in such a case will be very low due to the large distance between the two pleura and the minimal variation in this distance with the respiratory cycle. However, when a thoracentesis is considered in a patient with a small effusion, it will be very important to always determine what is the smallest distance between the two pleura during the respiratory cycle. The smallest distance will typically be found at end inspiration when the lung is maximally inflated. Studies have determined that if the interpleural distance is less than 10 mm, the risk of creating a pneumothorax is higher, even if ultrasound is used to guide the thoracentesis. For an added safety margin, it is recommended not to tap an effusion if the smallest interpleural distance is less than 15 mm, unless the operator has a very solid experience in ultrasound-guided procedures. The latter recommendation is also applicable if a structure other than the lung is found in the close vicinity of a small pleural effusion. It can thus also be stated as follows. Do not tap an effusion if the smallest distance from the chest wall to underlying structures is less than 15 mm. The intensivist should observe multiple respiratory cycles to avoid interposition of any vital structures.